One of the first signs of diabetes that might catch you off guard is needing to pee more often at night. If you're constantly getting up to go to the bathroom, it could be more than just a disrupted sleep pattern. It might be a warning sign of diabetes. Here's why. When you have diabetes, extra sugar builds up in your bloodstream, making your kidneys work extra hard to filter and absorb it. But when they can't keep up, that excess sugar ends up in your urine, pulling fluids from your body along with it. This results in frequent trips to the bathroom as your body tries to get rid of the extra sugar. It's your body's way of signaling that something might be off. Another important sign to watch out for is night sweats. If you often wake up drenched in sweat, it could be your body's response to low blood sugar levels during the night, a condition known as nocturnal hypoglycemia. When your blood sugar drops too low, your body kicks into gear, releasing emergency hormones that can cause you to sweat excessively. Managing your medication and tweaking your diet can help keep these night sweats under control, but always do so with your doctor's guidance. Before we dive into the next symptom, don't forget to hit that like button and subscribe for more insights. Third on our list is hypoglycemia, which can rear its head at night, causing more than just sweating and trembling. You might experience intense hunger, confusion, blurry vision, or even feel your heart racing. Hypoglycemia, or low blood sugar, is often linked with diabetes and tends to strike when your body needs energy while you're resting. When your glucose levels dip, your body responds with these symptoms, signaling that it's time for a quick energy boost. Keeping these symptoms in check requires regular blood sugar monitoring and a well-balanced diet. It's also essential to chat with your healthcare provider about your medications, as some can impact your blood sugar levels. In certain cases, a small nighttime snack with complex carbs and protein might be just what you need to maintain steady blood sugar levels throughout the night. Our fourth sign to watch out for is Restless Leg Syndrome, RLS, a neurological disorder that's more common than you might think but often goes unnoticed. RLS is characterized by an uncontrollable urge to move your legs, often accompanied by weird and uncomfortable sensations that can feel like aching, tingling, or even a creepy, crawly feeling deep inside your legs. You might wonder how this relates to diabetes. The connection lies in your nerves. Persistent high blood sugar, a hallmark of diabetes, can damage nerves over time, leading to a condition called peripheral neuropathy. This nerve damage can trigger restless leg syndrome, causing those mixed signals that make your legs feel like they constantly need to move. So, if you've been dealing with discomfort or the need to keep your legs in motion, it might be time to check your blood sugar levels. Coming in at number 5 is a sleep disorder called sleep apnea. This condition is marked by repeated pauses in breathing while you sleep, often resulting in a restless night and leaving you feeling exhausted the next day. The link between sleep apnea and diabetes is particularly significant. Studies have shown that people with diabetes, especially type 2, are at a much higher risk of developing sleep apnea. The reasons are complex, but make sense when you break them down. One major factor is obesity, which is commonly associated with both diabetes and sleep apnea. Excess fat around the neck can obstruct the airway, leading to those dangerous pauses in breathing. Additionally, diabetes-related metabolic issues like insulin resistance can play a direct role in causing sleep apnea. Insulin resistance can mess with your body's energy balance during sleep, leading to breathing interruptions. It's this intricate mix of factors that raises the risk of sleep apnea in people with diabetes. Next up is a symptom known as increased thirst, or polydipsia. If you're waking up in the middle of the night with a dry mouth, feeling unusually thirsty, it could be a red flag for diabetes. Here's why. When blood sugar levels are high, your kidneys work overtime trying to filter out the extra sugar. But when they can't keep up, that excess sugar spills into your urine, dragging fluids from your body with it. This frequent urination can leave you dehydrated, which in turn makes you feel thirsty. Managing this symptom is all about keeping your blood sugar levels in check. Regular monitoring, eating a balanced diet, staying active, and taking any prescribed medications can help. It's crucial to consult your doctor for the best ways to manage your symptoms. Don't overlook persistent thirst, especially if it's paired with other signs of diabetes. It's your body's way of telling you that something might be wrong. The 7th sign you should be aware of is fatigue. If you're constantly feeling worn out despite getting a full night's sleep, it could be a sign of diabetes. Fatigue in diabetes happens because your body struggles to use glucose for energy. When your body can't properly convert food into fuel due to a lack of insulin or insulin resistance, your cells don't get the glucose they need, leaving you feeling drained. Managing this fatigue involves keeping your blood sugar levels stable, which you can achieve through regular exercise, a healthy diet, and routine checkups with your doctor. It's also important to make sure you're getting enough rest and managing stress, as these are key factors in combating diabetes-related fatigue. Another symptom to watch for is dry mouth, or xerostomia. If you're frequently waking up with a parched mouth despite drinking plenty of water, it could be linked to diabetes. This happens because high blood sugar levels can reduce saliva production, leading to that dry, uncomfortable feeling. High blood sugar also causes increased urination, which can lead to dehydration, making your mouth even drier. To manage this symptom, it's important to practice good oral hygiene, stay well hydrated, and consider using saliva substitutes or stimulants if necessary. Chewing sugar-free gum or sucking on sugar-free candies can also help boost saliva production. As always, it's a good idea to talk to your healthcare provider to get the right diagnosis and treatment for this condition. Finally, let's talk about sleep disturbances. If you're wrestling with insomnia or find yourself tossing and turning all night, it might be more than just a bad night's sleep. It could be linked to diabetes. People with diabetes often experience sleep issues due to blood sugar imbalances that cause nighttime hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. Hypoglycemia can wake you up with symptoms like sweating or shaking, while hyperglycemia might have you making frequent trips to the bathroom. Managing these disruptions usually involves better blood sugar control through medication, diet, and exercise. Cognitive behavioral therapy, CBT, can also help address insomnia. If sleep problems are keeping you up at night, it might be time to consider diabetes as a possible cause and talk to a healthcare professional for proper diagnosis and treatment. In summary, the signs of diabetes that can sneak up on you at night include frequent urination, night sweats, symptoms of hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep disturbances. While these symptoms alone don't confirm diabetes, they're definitely worth discussing with your doctor. Diabetes affects millions of people around the world, and being aware of these nighttime signs can make a big difference in catching and managing the condition early. If you found this video helpful, don't forget to like and subscribe for more.